In the world of pharmaceuticals, few medications are as versatile and widely used as Inderal. Whether you suffer from high blood pressure, migraines, or anxiety, this medication has been hailed as a game changer in managing these conditions effectively. In this comprehensive guide, we will explore the uses and effects of Inderal, shedding light on its remarkable benefits. Inderal belongs to a class of drugs known as beta blockers, designed to block the effects of adrenaline and ease the workload on the heart. As a result, it helps to lower blood pressure, diminish the frequency and intensity of migraines, and alleviate anxiety symptoms. Unlike many other medications, Inderal is known for its safety profile, making it a trusted choice for long-term management. Backed by extensive research and medical expertise, this guide will delve into the optimal dosages, possible side effects, and precautions associated with Inderal. By arming yourself with knowledge, you can make informed decisions about your health and unlock the benefits of this powerful medication. Discover the potential of Inderal and take control of your well-being today. Understanding the uses of Inderal. Inderal, also known by its generic name propranolol, is a medication primarily used to treat high blood pressure, also known as hypertension. It works by blocking the action of certain chemicals in the body that can constrict blood vessels and increase the workload on the heart. By reducing blood pressure, Inderal helps to promote healthy blood flow and reduce the risk of cardiovascular complications. Additionally, Inderal is commonly prescribed for the prevention and management of migraines. Migraines are severe headaches that can be accompanied by visual disturbances, sensitivity to light and sound, and nausea. The exact mechanism by which Inderal helps in the prevention of migraines is not fully understood, but it is believed to be related to its ability to regulate blood flow in the brain and reduce the hyperexcitability of nerve cells. Furthermore, Inderal has shown effectiveness in managing symptoms of anxiety disorders. Anxiety can manifest in various ways, including excessive worry, restlessness, and increased heart rate. By blocking the effects of adrenaline, Inderal can help alleviate the physical symptoms of anxiety and promote a sense of calmness. In summary, Inderal is a versatile medication that is commonly used to treat high blood pressure, prevent migraines, and manage anxiety symptoms. Its ability to regulate blood flow and block the effects of adrenaline makes it a valuable tool in promoting overall well-being. How does Inderal work? Inderal belongs to a class of medications called beta blockers. Beta blockers work by blocking the action of adrenaline, a hormone that plays a key role in the body's fight or flight response. By blocking the effects of adrenaline, Inderal slows down the heart rate, reduces the force of the heart's contractions, and relaxes blood vessels. The main target of Inderal is the beta-adrenergic receptors in the body. These receptors are found in various organs and tissues, including the heart and blood vessels. By blocking these receptors, Inderal prevents the stimulation of these organs by adrenaline, leading to a decrease in heart rate and blood pressure. In addition to its effects on the cardiovascular system, Inderal also has an impact on the brain. It is believed that Inderal can reduce the hyperexcitability of nerve cells in the brain, which is thought to contribute to the development of migraines and anxiety disorders. By regulating brain activity, Inderal helps to prevent the onset of migraines and reduce anxiety symptoms. Overall, Inderal works by blocking the effects of adrenaline and regulating blood flow and nerve cell activity. These actions contribute to its effectiveness in treating high blood pressure, preventing migraines, and managing anxiety disorders. Common conditions treated with Inderal. Inderal is prescribed for a variety of conditions due to its broad range of effects on the body. Some of the most common conditions treated with Inderal include high blood pressure, hypertension. High blood pressure is a common condition characterized by elevated blood pressure levels. If left untreated, high blood pressure can lead to serious health complications, such as heart disease, stroke, and kidney problems. Inderal helps to lower blood pressure by relaxing blood vessels and reducing the workload on the heart. Migraines. Migraines are severe headaches that can be accompanied by other symptoms, such as nausea, vomiting, and sensitivity to light and sound. Inderal is often prescribed as a preventive treatment for migraines, helping to reduce the frequency and intensity of migraine attacks. It is worth noting that Inderal is not typically used to treat acute migraine attacks but rather to prevent their occurrence. Anxiety disorders. Anxiety disorders are characterized by excessive worry, fear, and restlessness. Physical symptoms, such as increased heart rate and trembling, are also common. Inderal can be used to manage the physical symptoms of anxiety by blocking the effects of adrenaline. It is important to note that Inderal is not a primary treatment for anxiety disorders but can be used in conjunction with other therapies. These are just a few examples of the conditions that can be effectively treated with Inderal. It is important to consult with a healthcare professional to determine if Inderal is the right medication for your specific condition. Inderal side effects and precautions. While Inderal is generally considered safe and well tolerated, like any medication, it can cause side effects. Common side effects of Inderal include fatigue and drowsiness. Inderal may cause a feeling of tiredness or drowsiness, especially when starting the medication or when the dosage is increased. It is important to avoid activities that require alertness until you know how Inderal affects you. Cold hands and feet. Inderal can affect blood flow to the extremities, leading to cold hands and feet. This side effect is usually mild and temporary but can be bothersome for some individuals. Gastrointestinal issues. Inderal may cause digestive symptoms such as nausea, vomiting, and diarrhea. These symptoms are usually mild and transient, but if they persist or worsen, it is important to consult a healthcare professional. Sexual dysfunction. In some cases, Inderal can cause sexual side effects, such as decreased libido, sex drive, or difficulty achieving or maintaining an erection. If you experience these side effects, it is important to discuss them with your healthcare provider. It is worth noting that these side effects are not experienced by everyone taking Inderal, and many individuals tolerate the medication well. If you are concerned about potential side effects or have any specific medical conditions, it is important to discuss them with your healthcare provider before starting Inderal. In addition to the common side effects, there are certain precautions and contraindications associated with Inderal. It is important to inform your healthcare provider about any pre-existing medical conditions, allergies, or medications you are taking. Some precautions to consider include asthma or chronic obstructive pulmonary disease, COPD. Inderal can potentially worsen symptoms in individuals with these respiratory conditions. It is important to discuss this with your healthcare provider before starting Inderal. Diabetes. Inderal can mask some of the symptoms of low blood sugar, hypoglycemia, such as increased heart rate. It is important for individuals with diabetes to closely monitor their blood sugar levels while taking Inderal. Pregnancy and breastfeeding. Inderal should be used with caution during pregnancy and breastfeeding, as it can potentially cross the placenta and be present in breast milk. It is important to discuss the risks and benefits with your healthcare provider. These are just a few examples of the precautions and contraindications associated with Inderal. It is important to consult with a healthcare professional to determine if Inderal is safe and appropriate for your individual circumstances. Dosage and administration of Inderal. The dosage of Inderal varies depending on the condition being treated and individual factors, such as age, weight, and overall health. It is important to follow the prescribed dosage and administration instructions provided by your healthcare provider. Generally, Inderal is taken orally, with or without food. For the treatment of high blood pressure, the usual starting dose of Inderal is 40 mg taken twice daily. The dosage may be adjusted based on individual response and blood pressure levels. It is important to monitor blood pressure regularly and consult with a healthcare provider regarding any necessary dosage adjustments. For the prevention of migraines, the usual starting dose of Inderal is 80 mg taken once daily. The dosage may be gradually increased if needed, based on individual response and the frequency and severity of migraines. It is important to note that Inderal should be taken consistently to achieve optimal migraine prevention. For the management of anxiety symptoms, the dosage of Inderal can vary depending on individual needs. It is typically started at a low dose and gradually increased as necessary. The duration of treatment for anxiety disorders may vary, and it is important to work closely with a healthcare provider to determine the most appropriate dosage and treatment plan. It is important to adhere to the prescribed dosage and not make any changes without consulting a healthcare provider. Abruptly stopping Inderal can lead to a rebound increase in blood pressure and potentially worsen symptoms. If you have any concerns or questions about the dosage or administration of Inderal, it is important to discuss them with your healthcare provider. Inderal interactions with other medications. Inderal can interact with certain medications, potentially affecting their effectiveness or increasing the risk of side effects. It is important to inform your healthcare provider about all the medications you are taking, including prescription drugs, over-the-counter medications, and herbal supplements. Some examples of medications that may interact with Inderal include calcium channel blockers. Combining Inderal with calcium channel blockers, such as verapamil or diltiazem, can lead to an increased risk of side effects, such as low blood pressure or slow heart rate. Close monitoring and dosage adjustments may be necessary. Antidepressants. Certain antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs, or tricyclic antidepressants, TCAs, can interact with Inderal and potentially increase the risk of side effects, such as low blood pressure or drowsiness. It is important to discuss these potential interactions with your healthcare provider. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen or naproxen, can reduce the effectiveness of Inderal in lowering blood pressure. It is important to discuss the use of NSAIDs with your healthcare provider to ensure the optimal management of your condition. These are just a few examples of medications that can interact with Inderal. It is important to consult with a healthcare professional to determine if any potential interactions exist and to ensure the safe and effective use of Inderal in conjunction with other medications. Long-term effects and benefits of using Inderal. When used under the guidance of a healthcare professional, Inderal can provide long-term benefits for individuals with high blood pressure, migraines, and anxiety disorders. By effectively managing blood pressure, Inderal can help reduce the risk of cardiovascular complications, such as heart disease and stroke. It can also improve overall quality of life by preventing or reducing the frequency and severity of migraines. In the case of anxiety disorders, Inderal can help manage the physical symptoms associated with anxiety, promoting a sense of calmness and improving daily functioning. By blocking the effects of adrenaline, Inderal can help individuals with anxiety disorders lead more fulfilling and productive lives. It is important to note that the long-term effects of Inderal may vary depending on individual factors and the specific condition being treated. Regular monitoring and follow-up with a healthcare provider are essential to ensure the ongoing effectiveness and safety of Inderal. Alternatives to Inderal. While Inderal is a widely used and effective medication, it may not be suitable for everyone or may cause side effects that are intolerable. In such cases, there are alternative medications available that can be discussed with a healthcare provider. Some common alternatives to Inderal include other beta blockers. There are several other beta blockers available that work similarly to Inderal. These include medications such as atenolol, metoprolol, and carvedilol. It is important to consult with a healthcare provider to determine the most appropriate alternative based on individual needs and medical history. Calcium channel blockers. Calcium channel blockers, such as amlodipine or nifedipine, are another class of medications commonly used to treat high blood pressure. They work by relaxing blood vessels and reducing the workload on the heart. These medications may be an alternative option for individuals who cannot tolerate beta blockers like Inderal. Antidepressants or anxiolytics. In the case of anxiety disorders, antidepressant medications or anxiolytics, anti-anxiety medications, may be considered as alternatives to Inderal. These medications work by targeting specific neurotransmitters in the brain to help alleviate anxiety symptoms. It is important to discuss these alternatives with a healthcare provider to determine the most appropriate treatment plan. It is worth noting that the choice of alternative medication will depend on individual factors, such as the specific condition being treated, medical history, and response to previous treatments. It is important to work closely with a healthcare provider to determine the most suitable alternative to Inderal, if necessary. Conclusion: is Inderal right for you? In conclusion, Inderal is a versatile medication that offers numerous benefits for individuals with high blood pressure, migraines, and anxiety disorders. Its ability to regulate blood flow, block the effects of adrenaline, and manage symptoms make it a valuable tool in promoting overall well-being. Before starting Inderal, it is important to consult with a healthcare provider to determine if it is the right medication for your individual needs. They will consider factors such as your medical history, current medications, and potential interactions or contraindications. By working closely with a healthcare professional, you can make informed decisions about your health and unlock the benefits of Inderal. Thanks for watching.